Hi everybody, I'm Amanda G, Psych NP, and this is my YouTube channel, Mental Health Matters, and we discuss all matters related to mental health. So the topic I wanted to talk about today is attention deficit or attention deficit hyperactivity disorder. And this disorder can occur in kids, teenagers, and adults. Now, if you're a parent and you have kids, probably almost everyone has thought at some point, I think my kid has attention deficit. A lot of hyperactivity and having a short attention span and having lots of energy and going from one task to the next and being very impulsive literally describes basically a child. So how do we know when it's a problem and it might be something that we need to check out or get looked into, get diagnosed, and then set up a treatment plan for the kiddo? One of the best tools that we have for identifying attention deficit hyperactivity disorder is called the Vanderbilt Assessment Rating Scales. And what that is essentially is questions that are filled out by the parent, and then the same questions are given to the child's teacher or preschool teacher or another adult that spends a lot of time with the child outside of the home, so that we have two different perspectives, two different environments where we're assessing for symptoms related to ADHD. A lot of times we diagnose kiddos when they first start school because, and of course, with the pandemic and with homeschooling and with online schooling, this has been totally, blown out of the water the past 18 months. And we unfortunately have not had this. This is why it's so important for our kiddos to be in school if they can, and if that's safe for them and their family, because teachers are a key component in really identifying normal versus abnormal behavior in kiddos. Now, of course, they aren't trained professionally to diagnose mental health disorders, but how many kiddos has a kindergarten teacher seen over the course of a 30-year career? Thousands. So they are able to say, if you're wondering it and you go to the teacher and you say, hey, I'm wondering, maybe this is an issue, I'd like you to fill out the Vanderbilt rating scales. They have a pretty good base for what's normal. If your child is not in typical traditional school, or you say what about the pandemic that we just had going on, and maybe they're not, they've been with us. Just somebody outside of your nuclear home environment to assess behaviors, because that's one of the main criteria for diagnosing attention deficit or ADHD, is that we've got these behaviors existing in more than one situation. So school, home, with peers, at soccer practice, at music. It's going to be all encompassing, and the child isn't going to be able to control themselves in basically all of those environments. Attention deficit is, I don't think there's any black and white in mental health. It's all kind of on a spectrum. There are kiddos that can live with it, and actually it can be more to harness that in the right direction, put them in a highly active sports activity, give them something that keeps their minds very busy, and they really can thrive. However, there's kiddos on the other side of the spectrum that they are struggling. They're struggling to have decent grades in school. They're struggling to get along with their peers because their impulsive behavior causes a lot of problems in that area. And you'll find that they just get very frustrated, very agitated, and their self-esteem can go down when they're unable to kind of perform at the level that their other peers are performing at. If you do want to talk about medication with your mental health professional or provider, that's a personal choice. Like I mentioned, there are many medications that are FDA approved to treat ADHD. There's also been many studies that have shown that kiddos that actually have untreated ADHD for whatever reason have a higher risk of substance abuse when they become older. I just watched an awesome documentary talking about Robin Williams and his son, and how they actually would use stimulants to calm themselves down and alcohol to calm themselves down, because they were never diagnosed with ADHD. But anybody who's seen Robin Williams, put on a skit is like, what's going on in that man's brain? Brilliant. But at the same time, if he was supposed to function in a traditional work or school environment, it would probably be really difficult for him. So, again, it's a personal preference. There's lots of things that you can do. There's homeopathic treatments too, essential oils. The main thing is getting a good provider that can, talk with you about your options and has a good relationship with the kiddo and can kind of steer you in the direction that you're looking for your kid. So thank you for watching this video. Again, I'm Amanda G, Psych NP, and this is Mental Health Matters. And today we were talking about attention deficit hyperactivity disorder. So there's so much more that we could talk about on this topic, and I really only touched on kiddos. There's also people getting diagnosed later in life, teen years, and adult ADHD also. So if you want to hear some more about that, maybe put it in the comments and then I can do a video for you. We can talk about that and things to look for. And if you want to subscribe to my channel, I'm going to continue to put on videos that facilitate conversations about mental health, because mental health matters, and hopefully you guys can get something out of it. Thanks so much.